I want to present to you Mr. Oliver, who is a 62-year-old male patient, and he was diagnosed with stage 4 colon cancer. And we actually gave him chemotherapy about 10 days back. And now he presented to the emergency with severe nausea, vomiting, and loss of appetite, and he has also hand and foot syndrome.
Right, well, I bet he's got a mutation in the DPYD gene. Was that checked?
Well, we sent it, but we still didn't get the result yet.
Right, okay. You still didn't tell me what chemotherapy did he have? Dihydropyrimidine dehydrogenase is an enzyme made by the liver that plays a role in thymine and uracil metabolism. Uracil is an important part of the drugs FOLFIRI and capecitabine. 2 to 8% of the population have a partial DPT deficiency, and those may have severe side effects if they were treated with a standard full dose of either FOLFIRI or capecitabine. And in these patients, an initial dose reduction would be indicated.
Well, Mr. Musa, I'm really happy to see you today in the surgery clinic, and I actually brought you here today to discuss the result of your histology following the removal of your bowel cancer.
Oh, perfect. I hope it is good news.
I understood that you had some concerns about the treatment.
Yes, actually, I'm not keen to start any chemotherapy. I'm afraid of the side effect and everything because I have bad history in my family with the chemotherapy before.
Well, I understand, but actually based on this report that I have in front of me, the cancer, although it is not advanced, we term it a T3 cancer, and out of the 15 lymph nodes that they have removed, only 5 had disease in them. But this is what we call a stage 3 colon cancer, and in these cases we usually recommend a chemotherapy.
Oh dear, I thought I was going to go away with it.
Well, don't worry, I'm going to refer you to our colleagues in oncology clinic, and I'm sure they will take good care of you.
FOLFIRI plays a role in the palliative treatment of patients with metastatic colorectal cancer disease, but doesn't have any role in the adjuvant setting. A study of nearly 1,300 patients with stage 3 colorectal cancer disease showed that the addition of irinotecan to FOLFIRI did not result in any improvement in the disease-free or overall survival. Right, Mr. Musa, I believe that you are not keen on chemotherapy, but I know that you've discussed with the surgeon before, and we're going to discuss it today in more details, and we're going to eventually come up with an agreement.
Thank you, doctor. I think I don't have option. I have to agree with both of you that the chemotherapy is necessary for me, but I must say that I have some specific consideration for my chemo regimen.
Of course, absolutely, and we always cater for different requirements with our patients.
Thank you. As you know, I am a professional athlete. I do swim, so I'm very keen not to have any peripheral or central line for the coming 6 months.
Yeah, that might not be a problem. We can give you a combination of a drip called oxaliplatin and a tablet called capecitabine, and you can get away with the line.
Okay, it's good to know this. I also need to tell you that I'm playing guitar, and I do need to keep playing guitar. I'm not keen on losing my nerve. This is very important for me.
Well, I think we can also cater for this requirements as well, but this would leave us with one option only, and we're going to discuss it further.
Thank you so much.
The standard adjuvant treatment for stage 3 colorectal cancer is the combination of oxaliplatin and fluorouracil-Based. However, single agent fluoropyrimidine can also be considered in certain circumstances. The X-ACT study compared capecitabine with bolus 5-FU as adjuvant therapy for stage 3 colon cancer showed that both agents be equivalent in disease-free and overall survivals. Neuropathy is a recognized side effect to oxaliplatin, but not to fluoropyrimidine. On the other hand, both capecitabine and infusion 5-FU can cause significant diarrhea and hand and foot syndrome, which can be more severe in patients with DPYD deficiency.
Hi, Doctor. I hope you have got the CT scan report that I have done a couple of weeks ago now.
Yes, actually we have done a CT scan to assess the response to the chemotherapy and targeted therapy you have been taken for cetuximab. We have been taking it for 6 months now, and we are looking now at the results.
Yeah, of course. Because the first CT scan after 3 months of treatment did show some good results, and the tumors that I had in the lungs, the liver, the lymph nodes, as well the colon cancer, they all responded. I'm really hopeful to see some more positive results.
But I'm afraid in this CT scan, we actually found some progressive disease in the lung with new lung lesions.
Oh dear. Is there anything could be done now, Doctor?
Well, we have more treatment options that we can use to control this disease. I have to discuss with my consultant, but I think we might offer you a chemotherapy called FOLFIRI plus panitumumab.
While FOLFIRI is indeed a reasonable second-line backbone chemotherapy, panitumumab is not, given that he has already been treated with anti-EGFR therapy in the form of cetuximab. Panitumumab given in the second-line setting is not a reasonable option to have. He has no listed contraindication to receive anti-angiogenic therapy, and hence the addition of bevacizumab to a backbone chemotherapy would be a reasonable option for him to have.
This is Acting for Clinical Education. Like, share, subscribe.
Don't forget to check the resources down below and join us every Thursday 8 p.m. for more videos.